Hey everyone, Dr. Bice here. So let's blast off into talking a little bit about infant development. Development in infancy is one of my favorite topics, and it's really honestly just for the plain truth that infants are so cute. You'll see that when you get into practice here as a nurse practitioner, you'll see how cute babies are. They're lots of fun to care for. All right, so the first thing I wanted to go over and really is what normal development is like for an infant. Okay, first off, to explain a little bit about what I will be speaking of, there's a difference between fine motor skills and gross motor skills, also difference between motor and oral development. So fine motor skills are those skills that pertain to coordination of muscle movements in the body, like the eyes, toes, and the fingers. Okay, they allow a child to write, grasp small objects, fasten clothing, etc. On the contrary, gross motor skills are skills that are learned or acquired when a baby is still growing up into early childhood. And it's safe to say that gross motor skills come from a huge group of muscles and the movement of the entire body. Things such as walking, running, learning to get upstairs, etc. So in infancy, okay, so let's start here at birth. I'm going to turn on my little pen so we can circle some things as I'm talking. So talking about birth first, okay, what you would essentially see in a baby who's just born is a lot of flexion, okay? So obviously whenever you see that a baby is well flexed, you'll see their arms and their legs will be pulled up toward their body. That's normal for a newborn. Okay, oral movements, you might see sucking or tongue movements, extension and retraction of the tongue as the baby is learning what is inside their mouth. You're going to see a lot of up and down jaw movements, movement of the lips. And then motor development for infancies that are new or infants that are newborns, you're going to see some slight head control while they're sitting, but very, very minimal. All right, so next, let's talk about a 1 month old, okay? So 1 month old, you're going to see some extension in non-directed hand swipes. Okay, so they're getting a little bit older. They're able to do some extension of their arms and their legs, a lot less flexion since they're getting out of that newborn period. You will still see that rooting, which is kind of moving toward something to suck on. So if you tickle a little baby's cheek around the age of 1 month to 2 months, you should see the baby rooting towards you. Newborns do also do this, but it's a little bit more prominent around 1 month old. And that's just because they're learning where to turn and what to go to for rooting toward what they want to eat. Motor development, so down here we do see infants who are around 1 month old turn their head, which is good. All right, so around the age of 4 months old, you're going to see more directed swipes, okay? A lot of reaching at the age of 4 months. They're fixing their eyes on things, so they're learning to get out there and really grab for things. They will grab for things in front of them, grab for things that they see around them, etc. For motor development, you will see them sit up with some support, okay? But this is very, very early sitting up with support. That means that they would sit with mom or dad or grandma or papa holding them up in the lap or with a bunch of pillows around them. They may begin to roll over, all right, head steady and sitting, which is good. They can hold their head up pretty good by this age. All right, so around the age of 4 to 5 months, you do see the Ulnar-Palmar grasp, and you also see that the child looks as if they're swimming in the prone position. It's kind of like they're learning to put their arms out in front of them and push themselves to sit up. They have a lot less head lag at this age, and they're able to hold themselves up in that on the belly position really well. They're preparing themselves because as they get to 6 to 7 months old, they're going to start sitting independently, rolling over really well, okay? The rocks the hands and knees, and that's basically while they're sitting kind of like in the crawling position. They're rocking on their hands and knees back and forth, and then free head to lift in the prone position. And that's basically just getting a lot more control of their head as well. You will also see a radial palmar grasp or raking, kind of more intentional use of their hands as they get to that 6 to 7 month age. All right, so around 7 to 8 months, You're going to see in that fine motor a more radial to digital grasp, okay? Additionally, in their mouth, you're going to see phasic bite reflex, rhythmic bite and release patterns. So a lot of opening and closing of the mouth, using those gums a lot. Support weight when they're standing, bouncing when they're held. Okay, so at this age, they're not standing and walking well yet, but they might be able to be held in the lap of a caregiver and stand on both of their legs well while holding hands or holding the waist. Oops. All right, so around the age of 7 to 9 and 9 to 10 months, we see quite a bit of growing, which is great. And they start really rapidly doing that onto 12 months. So scissor grasp comes around fine motor around 7 to 9 months. A lot of chewing, okay, learning to use their mouth still and their teeth that have already developed, but nothing super extensive because at this age they're not eating anything that is terribly texturized. They're sitting alone really well on their own between the age of 7 to 10 months. They're also possibly crawling. Okay, cruising is another thing between the age of 9 and 10 months that babies start to do. What cruising means is they are getting up, pulling up on their own and walking around while holding on to things. Okay, so pulling to stand comes before they cruise. And that is something that happens before a child walks independently. Next, around the age of 12 months, you're going to see infants picking up small things with their pincer grasps. A pincer grasp is basically the grasp between the thumb and the forefinger, and it's a way to let you know as a provider that they have developed that mastery fine motor development in infancy, and it's important that they learn how to do that between 12 and 15 months. Okay, oral development, chewing with spreading and rolling of tongue movements, tongue lateralization, that means moving the tongue from left to right. Okay, moving their jaw around quite a bit as they learn to develop for a little bit more tough foods, things that they will not be eating in infancy, but they are going to start eating in toddlerhood. And then they may start to walk with one hand held or stand alone momentarily. It is possible that you'll see some children at the age of 12 months walk. A child does not have to walk until 18 months old. Parents will frequently come in very upset and want to know why their child, who is 13 months old, is not walking yet. Provide them encouragement, provide them reassurance that that's totally normal, all right, and that walking is an independent thing that babies do on their own, and they must learn to really master most of these skills before they can walk. Now, I have seen babies walk before they crawl, so that's a possibility, but most of the time, the greater percentage of children will go through all of these gross motor developments before they begin to walk independently. Again, children should not have to walk until 18 months old. It is not considered a problem until they are 18 months old. All right, so next I wanted to go over a little bit about receptive and expressive language in infancy. Okay, so between receptive and expressive differences there is what an infant can receive and what an infant can express or say. Okay, there's not a whole lot of conversation going on, obviously, between 0 and 12 months, but these expressive and receptive development are really important as they move into getting a little bit older for their speech development as well. So between the ages of 0 to 3 months, okay, they're going to look to mom and dad or whoever's taking care of them. They're going to turn their head and their eyes, okay, to soft spoken voices, smiles and coos, all right. Expressively, they're going to have pretty strong cries, gurgling and cooing, okay? Possibly some single syllable repetition, but you're not going to hear a whole lot of intentional sound between the ages of 0 to 3 months unless it's crying, unfortunately. All right, so between 3 and 6 months old, infants can seek sound sources. Okay, they're going to be looking for those sources of sound in the people around them. They may look in response to their own name, but more often they're going to be looking in response to talking in general. Okay, They may respond to angry or happy voices. Hopefully those infants are hearing more happy voices. Expressively, between the ages of 3 to 6 months, they're going to be doing a lot. Okay, they're going to be increasing in their babbling. They're going to be increasing in the sounds they're making, like a gaga and the coos and the laughs. Okay, infants should be laughing and smiling a lot by the time they reach 4 to 6 months old. All right, so one of the things I usually tell my students is if you walk into a 4 to 6 month old well visit and you're not getting lots of smiles, that's a concern, because they're not at an age yet where they're super scared of you, and they are at an age where they will respond to smiles back. So if you're smiling big at infants, you've got a big old smile on your face, you should see those smiles back at them. All right, so 6 to 9 months old, this is when speech gets a little bit different because they're also getting a lot smarter. Okay, so they're going to look at family members and they're going to understand a little bit what no means. Not necessarily cognitively, they're going to understand exactly what it means, but they will understand that no is said often and that it means something clear. Okay, they are getting interested in pictures at this age, and they like to look at those pictures, and they may look back up at mom and dad and smile after seeing those pictures. They will babble a lot, lots of sound combinations, and these are sounds that they're not meaning to make with any real intention. These are just sounds that their mouths and their tongue and their oral motor skills can make that are unintentional as they continue to learn. The specific things and specific sounds they may make are mama and dada around this age and on up to 12 months. It is a lot more common for infants to say dada before mama, and that is simply because the D syllable is a lot easier for an infant to say than the M syllable. So do encourage mommies who feel a little sad about that it's quite all right that they do not say mama first. All right, so one of the other things I wanted to talk to you very quickly about, this is kind of a larger table, but I do want to just go over some of the things quickly. I want you to have a good understanding of what some of the red flags in infancy are. Okay, I'm not going to go over every one of these. These tables are found in your Burns books, so I find that it's real easy to learn by tables if you're a visual learner, but it's important for infants to be assessed for development because those red flags in development can be found. If you know what normal is, then it will be easy for you to assess what abnormal is, okay? And so the red flags are simply the opposite of what I've just been discussing with you that is normal, okay? So with regard to gross motor development let's just pick one. So a 6-month-old, if you're seeing persistent primitive reflexes, okay, persistent primitive reflexes mean if you're seeing a lot of newborn reflexes, okay, so the tonic, clonic or tonic neck reflex or the Moro's reflex or a lot of those things that happen when babies are newborns because they are just primitive. In a 6-month-old, that's something that you would be concerned about because by 6 months, they should be getting rid of those primitive reflexes and moving on toward more developmental fine motor, gross motor, and older infant reflexes. Okay, head lag still in a 6-month-old is a big concern. Okay, a 6-month-old should be learning to sit up on their own with support, and if they've still got a lot of head lag, then they're not going to be able to sit up with support, and there is a possibility that they've got some kind of problem with brain development. Additionally, scissoring. Okay, what scissoring means is if you hold a 6-month-old baby up, or at any age, if you hold a baby up underneath their arms over a table and their legs cross over kind of like scissors, that's a problem because that also could mean something is wrong with neurodevelopment that's causing that infant not to have really good, strong extensions and less reflexive or less well flexion that a newborn infant would have. All right, so again, I'm not going to go over all of this, but I would love for you to have a good idea of what normal is so that you can recognize some of the red flags of abnormals. The last thing I wanted to go over with infant development is something that is really important to all mommies and daddies who come in with an infant: sleep. Please be able to tell them that peak of crying, okay, unexpected, resist soothing, pain-like face, long-lasting, and evening cries are really normal.